I want to give an overview of the technology, and then spend most of the presentation talking, expanding further on, Tim was talking about some validation research and some of the validation research we've done with the platform, and then answer any questions and hear from the other incredible panelists. Part of the reason why I was attracted to pediatric orthopedics is the mission-driven nature of helping children. I really found that to be highly motivating and focusing, and I wanted to bring that same sort of passion and energy to Osso VR. So I want to share our mission with you all, which is to improve patient outcomes with better education and assessment, increase the adoption of higher value medical technologies, and democratizing access to surgical training all around the world. Osso VR is home to over 60 employees. We have incredible team members, including our VP of Product, Anu Kirk, who's the former general manager of all of Sony PlayStation VR, who took PlayStation VR from a concept to one of the world's most successful consumer VR headsets. We also have Jonathan Sabella on our team, who's famous for having supervised the first team to win an Oscar for their work in VR for a VR film, and I'm going to show you some of their work a bit later. We're also home to the world's largest medical illustration team, and this incredible team in terms of size and talent and scale is really in thanks to our backing, which is Kaiser Permanente Ventures. We've raised over $17 million in venture capital from top healthcare venture capitalists, which allows us not only bring quality to the table, but scale. So what is the problem we're actually trying to solve? So there are really three dynamics, and then the fourth dynamic, of course, is COVID. The first dynamic is there's just too much to learn. So Tim was talking about this a bit, that we're victims of our own success in a way. Accelerating science and technology has massively expanded the library of procedures healthcare professionals are expected to know how to do at a moment's notice. For example, one time I was eating lunch and I was called urgently to the zoo to operate on a gorilla, which I was vastly underprepared for. It was very exciting, but an extreme example, but every surgeon or physician never knows what's going to come in the door on any given day. The second part of the problem, once again, what Tim was alluding to, is the increasing complexity of the procedures that we perform. So learning curves are getting longer. They're going from 10 to 20 to 50 to 100 cases to reach proficiency. The third part of the problem is that there's really no good way to assess technical skill in healthcare. The only time I've been assessed, I was interviewing for a program, and they had me play the board game Operation, which is a true story. Then, of course, there's COVID, which we're all too familiar with, which makes it very difficult to train the main way that we train, which is with patients or at large-scale conferences and courses. And the picture on the left, a friend of mine took that picture during their residency. It's an instruction manual folded out on the patient while they're operating, which highlights sort of the extreme nature of the problem. So I was able to encounter VR very early with the Oculus DK1 because of my gaming background, and immediately saw its ability to solve this problem, as many of you are taking different angles with. For technical training, it allows you to use your hands in a realistic way. It allows you to simulate any procedure. You can use it anytime, anywhere. You can train as a team, train remotely, and get objective assessment. So I want to show you what Osso VR looks like in practice, to just show a few key things here. So obviously everybody in this conference has tried virtual reality, and probably most of the people watching this video have tried virtual reality as well. But when it comes to technical training in healthcare, when people see or try Osso VR, they're like, wow, this is quite different from what I've experienced before. And part of it is bringing techniques from leading movie studios like Industrial Light and Magic and Marvel, and gaming studios like Electronic Arts, Apple, Microsoft, to surgical simulation to create a level of fidelity that really hasn't been accomplished before. You can see the individual pores in this patient's skin, not only an incredible level of visual fidelity, but running on Oculus Quest and Oculus Quest 2 standalone VR. So that's really what is the technical accomplishment here, which is taking techniques from games like Vader Immortal and bringing it to surgical simulation so that we can benefit from it as healthcare providers, and our patients ultimately can benefit from it. What also we're demonstrating here is the ability to train collaboratively. So the avatar you see here in the surgeon spot, that's me in LA, and I'm practicing with our VP of Sales, Dave, in New York, operating in the same room. You could be across the world, around the country, and not only are we operating together, but it's how these sessions are scheduled and take place that Osso VR makes very reliable and user-friendly and easy to set up, so that we can continue to train despite the physical restrictions we're currently under. And I know most of the people in this conference have tried collaborative training. Tim and I jumped into VR once, and the first thing that Tim said to me was that, wow, I haven't been with another person in the same room in weeks. This was like during peak lockdown. And I thought that was really fascinating because we weren't physically together in the same room, but that just kind of slipped out of his mouth. And it's just really the power of connection with virtual reality and technology like the Oculus Quest and Quest 2. Osso VR not only brings quality to the table, but scale. So we're home to the world's largest VR surgical training library that's expanding at a tremendous rate. So I want to end the talk briefly talking about the validation research behind what we do. So the first study I want to talk about was performed independently at UCLA, where they were trying to understand how VR compares with overall skill transfer compared to traditional training. So traditional training would be lecture, technique guide, illustration, and list of steps. So the individual you see on the right was trained with Osso VR to a set level of proficiency, while the individual you see on the left was trained traditionally. So you'll see the individual on the right gets a congratulatory handshake, great job, buddy, strong work. And on the left, you'll see that the individual is kind of checking this piece of paper a number of times. So that's a cheat sheet. It's a list of steps you can check if you need to. He actually checks this sheet 26 times in this run through, while on the right, the Osso VR trained and assessed individual checks it 0 times. And that's really what objective assessment gives you. The individual on the left was allowed to take as much time as he needed to prepare and came in when he felt ready. The individual on the right came in when he was objectively measured to be ready. And it shows you that how we feel and what reality is often are quite different. And right now in healthcare, we are really driven by feelings and intuition when we're making decisions to bring new procedures or procedures we haven't performed in some time to patients. And you can see what a difference that is. So 20 trainees, half were trained with VR, half were trained traditionally. In every single assessment category of something called OSATs, or the Objective Structured Assessment of Technical Skill, the Osso VR trained and assessed individual performed significantly better for a net improvement of 10 points or 230%. And this was published in the Journal of Surgical Education early this year. We had our second level 1 randomized clinical trial published in a top 5 orthopedic journal called Core, which looked at a trainee's ability to perform a procedure without supervision. What that showed that with traditional training, 25% of the participants were able to perform a procedure without supervision. But when trained and assessed with Osso VR, that went up to 78%, so a 306% improvement. We also had what I believe to date is the world's largest VR validation study with 38 participants. Not 100% sure of that, but once again, this was performed at a hospital in California. Every single metric was significantly better when using Osso VR training and assessment. A study performed at Wake Forest looking at the enjoyability and kind of how people feel about VR, because I think sometimes it's easy to get sort of excited about the technology and it's effective, but if people don't enjoy learning this way, they're not going to use it. Engagement is a critical aspect of any digital learning modality, and this study showed that 100% of the residents at Wake Forest found Osso VR to be effective, would recommend it to their peers, and found it to be enjoyable and intuitive as well. So just scratching the surface, I know we don't have a lot of time here, but I am tremendously excited about all the work everybody is working on in this space. I think the take-home point that I would say is really just echoing Tim's talk is really focus on the problem you're trying to solve, and then understand what is your goal, like what are the metrics or the KPIs that you're trying to impact, and then are you actually impacting those with your solution, and measure them scientifically to ensure that what you're doing is working. I think it's an incredibly exciting space right now, both VR and across sort of the technological spectrum with mobile AR, holographic headset displays, and it's often easy to get lost in all of the options and lose sight of the problem you're trying to solve at the end of the day. So really doubling down on what Tim said, really understanding the problem, the KPIs, and making sure that you have the impact that you set out to perform to begin with is kind of what I'd love for you all to take home. But thank you again for David for the opportunity to present, and Claudia, and I'm looking forward to hearing from the other panelists.